Hi friends, my name is Dr. Pankaj Talwar and I am working at Birla Fertility and IVF as Head Medical Services of IVF Division. So before I begin with my talk, I would like to introduce Birla Fertility and IVF to you all. At Birla Fertility and IVF, we have got doctors who have got experience of more than 20 years and who have carried out more than 14,000 IVF cycles. We specialize in offering tailor-made treatment for all the couples depending upon their requirement in very transparent and ethical way. So today I'm going to talk to you about the male infertility, the causes of male infertility, how it arises. We'll talk about the various methodologies of treatment for the male infertility and the outcome of the treatment. Whenever a couple is unable to conceive after 1 year of staying together, we label them as having male or female infertility. The male factor infertility is on the rise nowadays and nearly 50% of the couples are suffering from the male infertility. A large number of the men who come to us are having sexual problems. These can be actually sexual problems or they can be psychosexual problems. So at Birla Fertility and IVF, we specialize in this treatment and we've got a separate unit looking after the men who comes to us with psychosexual problems also. So as we see, the male infertility is playing a major role in causing infertility in the couples. Till around a decade back, actually we never spoke about the male factor infertility. We were only concerned with the female factor infertility. We always thought in case the lady or the couple is not conceiving, the fault lies with the female. But nowadays, with the increasing knowledge and increasing incidence of the male factor infertility, we are focusing on the males also. We have to understand that the male is equally responsible for formation of a good quality embryo and the baby. In case the male sperms are not good, the quality of the baby or the embryo may not be good. It may result in either infertility or it may even result in multiple abortions or poor pregnancy outcome. Now when we talk about the male infertility, there can be multiple reasons. The reasons can be multifactorial. There can be something wrong with the semen count. There can be something wrong with their behavior, or there can be something wrong with their reproductive health. When we talk about the sperm count, we normally follow the WHO parameters. The normal sperm count of the male is more than 15 million per ml. When the sperm count falls less than 15 million, we can easily label the man to be having male factor infertility. But the sperm count is not the only one. We look at the multiple factors. The other factors can be shape of the sperms, which we call as morphology. It can be the DNA integrity of the sperms, or it can be the sperm motility. There can be the problems with their motility or the speed. So we are having multifactorial reasons for having a mixed sort of presentation of the male factor infertility in today's world. In our practice, we have found the commonest cause of male infertility is the lifestyle disorders. Lifestyle is playing havoc on all of us, is playing havoc on our lives, is playing havoc on the sperm count. One of the commonest causes of male infertility is smoking. And smoking, either primary or by inhaling the smoke when other people are smoking, can both lead to the male infertility. So we always say that as far as possible, don't smoke and even don't go near the people who are smoking. Smoking can directly lead to the effect on the sperm count. It can also lead to multiple problems like erectile dysfunction. Both these conditions can lead to male infertility and cause problems in the married life. The other factors can be taking excessive alcohol. Taking alcohol in moderation once in a week, we really can't comment upon that. But anyone who's a regular alcoholic can lead to multiple problems. As I've told you, like the smoking, it can lead to low sperm count, or it may even lead to impotence. Alcohol and smoking don't only affect the sperm count, it can affect our brain, it can affect the heart, and it can affect our testes. And finally, the outcome is low sperm count, or there can be impotence and sexual dysfunction. What we have noted recently is in the men or in the young boys who are using a lot of mobile phones or working on laptops, they all have low sperm count. Excessive use of mobile phones or laptops and working on the laptops, keeping them on your laps, can actually lead to low sperm count. So my message to all of you would be that as far as possible, don't keep your mobile phone in your pockets, keep it away from you, and don't work on laptops for long times, because laptops can actually give out radiation and laptops can generate heat and that heat can cause damage to our testes. So as far as possible, avoid keeping laptops on your lap, and in case you have to work on them, keep them on a stand away from your body. Other common conditions which can lead to low sperm count, we have noted in our practice, the men who have got any thyroid problem, or who have got diabetes, or who are obese, who are unhealthy eaters, who have unhealthy lifestyles of working, who are working till late nights, they tend to have low sperm count. So our message would be that as far as possible, the men should be maintaining their normal weight. One more common problem which we are facing day in day out is incidence of varicocele. Here our message to you would be, don't worry much about varicocele. Don't worry much about an ultrasound diagnosed varicocele. Varicocele can lead to low sperm count definitely, but every varicocele doesn't require surgery. We only operate when the person has gotten clinical varicocele with a prolonged infertility. But yes, the final call would be taken by the doctor. But from your side, I will suggest that as far as possible, when you go for your annual health checkup, always make the doctor examine your testes one. As a result, in case we have varicocele, that can be diagnosed early. So we have noticed that all the men who are having these problems, infertility, low sperm count, along with these particular diseases, they tend to have high DNA fragmentation index. At Birla Fertility and IVF, we've got a separate dedicated unit which looks after the men's health, and we have got specialized trained doctors who will help you in case you come to us. So whenever you go to the doctor, besides the sperm count, you have to look at other parameters. Read your report and try to understand your semen analysis report. Count is important, but along with the count, we have to look at the sperm motility. How are they moving? Are they moving very quickly, or are they moving sluggishly, or they're not moving at all? One more reason which can lead to male infertility is sexually transmitted diseases. Though it is now, we are controlling it, men have become more educated, but still we find some men who are sexually promiscuous, they can have this problem. So my advice would be that avoid getting a sexually transmitted disease, because these can lead to the blockage of the ducts in the testes, and they can lead to low sperm count or blockage of the ducts, which will lead to azoospermia. Now coming to the final word, how do we manage male infertility? It's pretty simple. As we have already discussed, we should stop smoking, don't take alcohol, lose your weight, have healthy diet, don't have late nights, avoid using mobile phones and laptops, and be a good boy. In case we are back home at the right time and we are with our spouses, we are having a healthy lifestyle, and we do some running, yoga or meditation, definitely things will become better for us. We also find a lot of young men come with low sperm count or impotence. So they are the people who go to the gymnasium, they pick up a lot of weight, they do a lot of athletic activity, and along with that they take some protein supplements. Now taking these protein supplements, which may contain some hormones, can lead to the problem. So whenever you go to the gym, you ensure that you don't take such protein supplements which contain hormones, because they can lead to low sperm count and even damage to the testes. So to end my talk, I would like to tell you, to have a good life, to have good healthy sexual life, to have good number of sperms being produced, we have to basically carry out certain things which are generally lifestyle related. There is no male in today's world who cannot reproduce. The technologies have become better, the methodologies have improved. If any one of you is having this problem, you are welcome to visit Birla Fertility and IVF. If any one of you who knows someone who has got this problem, you can refer them to us. We are one-stop shop for all these things. We've got a wonderful laboratory, embryology research lab. We've got very qualified gynecologists. We have got very much trained urologists and andrologists to look after you and put you back into the mainstream, and I'm very, very sure you'll be able to conceive very soon. Sperm count which can be low or no sperm count, or any other factor which can lead to male infertility, we'll be able to manage and help you. At Birla Fertility and IVF, we work 24/7. We are also working on Sundays. So if you want to contact us, you can call us up directly. You can visit our website. In case you want to meet us, visit us or talk to us, you can definitely go to our website. You can take an appointment from our call center. We are here for you 24/7. You can meet us in person or you can take an online consultation. Thank you very much.